Are we on? Can you hear me?
Can you hear me? Microphone check. Lights. Cameras.
This is swanky. This is lifestyle. This is culture. Welcome to the social center of everything culture. Culture Daily.
9 here on Culture Daily's Morning Bites all the way till 10 on a great conversation we're going to be having this morning. Listen, it's still the month of October, and you know the month of October is completely dedicated to the awareness of breast cancer. We'll give you staggering numbers and why it's very important that both men and women get checked. Earlier on in the show, we rolled out our official campaign message, if you can say that, since it's campaign season, our campaign message on breast cancer awareness. As you can see, all of us clad in pink, the bold color, saying stay abreast, check regularly. Very important message we're putting out there this morning. We'll be getting to the conversation. I'll introduce all my guests this morning on the show. But before that, real quickly, it's important for us to brush our teeth morning and evening with Pepsodent Cavity Fighter toothpaste. Why? Because if you don't, your teeth after eating, if you don't brush your teeth regularly, it can lead to tooth decay, gum disease, and in some cases foul breath. So brush your teeth every morning and night with Pepsodent Cavity Fighter. It gives your teeth the protection it needs, leaving you with 10 times stronger teeth. It is fortified with pro-fluoride and micro-calcium ingredients, Lenny, sealing tiny and invincible holes in your teeth, prevents cavities, and keeps your teeth and your mouth very strong and also very, very healthy. Great news for you. Also, head to Live Resto Lounge in East Legon, down La Bauleshi Road. Enjoy special dish like toza, fio muto, granite soup, fufu, light soup, tilapia, chicken, goat meat, a variety of meals for you. Call 020-133-7766 now to experience Live Resto Lounge. In the middle, I'll also tell you about Lancaster University and the great deal they have for you on there. But moving into our conversation this morning, it's been a Tuesday. It being a Tuesday, we focus our Tuesdays on health conversation with our regular face, Dr. Chris. So Dr. Chris is live with us this morning on the show. We're going to be talking about breast cancer, early detection, treatment options, debunking myths around it, and also officially launching out our awareness campaign on breast cancer. Before we do that officially, let me put our bold logo representation of creating awareness on breast cancer again for you on the screen, so that you can ready yourself for this conversation. So my team will do that for us. And like we say, stay abreast, check regularly. Well, anyway, so that is our message officially on the screen. Pardon for that short break in there. But studio is very pinky this morning, I must say. Let me start by introducing my special guest, aside Dr. Chris. He's not our special guest, he's our guest. We are here with our CEO, Madam Rashida Yasmin Abdullah. Good morning. Good morning. Yes, looking bright and looking bright and pinky. Today I'm giving, I know. Let me relax for me. But is it me, or I think that the color pink works? Yes, it's working on me this morning. But please allow. I'm taking. So, Madam Rashida, welcome to the show.
Thank you. Very
important for you to be here. We are also honored to be here with Bridget Yvette Simpi Brimpong. Good morning.
Good morning.
Yes. Welcome. Aside everything you do today, in the capacity of the reason you are here, a breast cancer survivor, we are honored to have you here join us this morning. Thank you so very much.
Thanks for giving me the opportunity to.
Yes, you're welcome. Please, I think I'll move you closer to the microphone. Yes, so you can speak out loud and we can hear you. Like I mentioned, Dr. Chris, you're here with us. So thank you. Lenny, do you want me to introduce you as well?
Please do.
It's fine.
Please introduce me.
It's a very important month for us, and I'm taking this take from our CEO on why it's important for us as media personalities, media owners, media stakeholders to be part of a month such as this.
Thank you, Jay. I think it's very, very important, and I can't hammer it more for media houses as us to educate our viewers more on breast cancer. I don't think we should just pay attention to October. Year long, it is important that this awareness is drummed in the ears of all individuals. Why? Viewers watch us all the time. They trust us. We are the ones who can get the opportunity to bring in guests, as we've just done, who can narrate their ordeal or their story, and through that we can pick one or two from it and use it to, live our lives. Education is key. I believe if we sensitize people enough, or people are abreast about this breast cancer menace, it will be kept in a way. Early detection will go a long way to save lives. That is why I think all media houses out there should support this initiative and drum it home. And I don't think October alone is enough. All year long, if we can drum it out there, it will be key, because it will surprise you to know that a lot of people are not educated on breast cancer and they know nothing at all about it. So if they start having these symptoms, they don't even know what to do or where to run to. So I believe programs like this will educate them out there, and they will know the early detection, what they should see, and when they should run to a hospital or a doctor to get themselves checked and saved. I believe early detection saves lives. That is why we are a part of this awareness.
Thank you very much. Rightfully said, it shouldn't be even only centered on October. It can be amplified a lot in October, but I think we all fall short of leaving it or letting it go after the last day in October, and then December, and then we are jamming all through one whole year. Anyway, so thank you very much, Madam Rush. Questions at this point in time to our doctor, very open. So we'll be asking questions on it. But Doc, I'll be coming to you shortly. But let me just go to Madam Bridget this morning with us to tell us the story of how you became a survivor of breast cancer.
Thank you, Jay. Back in 2010, I was the project manager for Save the Women Solidarity Forum, where we do sensitization on breast cancer. Our last project was at Afienya Youth Center. But then I noticed a lump in my breast. But I was so busy with the program that I didn't even get time to sit in the education during the program. And so I ignored the lump because it wasn't painful. Then in 2019,
I'm sorry, but let me just go back to that moment. I know it's a house of questions, so we'll ask questions. When you mentioned noticed a lump, was it an overnight? Did you feel any pain at a point in time, or one morning you woke up and you felt a lump?
Okay, so it was a small lump in my left breast.
Okay,
it wasn't painful. You could feel it moving. But it wasn't painful.
Okay.
And I couldn't talk to anybody about it then. So in 2019, I remember one weekend I drove myself back to the village for a funeral. But on a Sunday morning, I couldn't even wake up. Then I had my last son, who is now 7. I couldn't even wake up to breastfeed him. It was so painful, I broke down. There is a history of breast cancer in my family. My paternal auntie died of it 40 years ago. So family who was around were worried. I remember a doctor friend in town came to see me, gave me some painkillers and an antibiotic, and asked his driver to drive me back to Accra because I couldn't do anything.
Wow.
When I came back, because the pain subsided, I didn't even report to the hospital. So he called again, following up. Have you been to the hospital? I said, not yet. What are you waiting for? Well, I didn't even know what I was waiting for, but I just didn't go. About 3 months down, there was another, it was in October, I remember very well. Then I went for a screening. But because I was still breastfeeding, I was asked to go back after breastfeeding. I shouldn't have listened.
You shouldn't.
So I went back again, and it kept growing.
With the lump and the pain?
Yes. Then, when I decided to go to the hospital, my gynae actually referred me to a surgeon. So she asked me to do a biopsy, and then I did, and she asked me to come with a family or my spouse, my husband. So I went, and she broke the news. That day, I don't know how to describe it, but it's as if you are done. Yes. It wasn't a pleasant news at all. I cried the whole night, but waking up, she gave me treatment options. I was supposed to do a mastectomy, that is total removal of the breast. Then chemotherapy and radiation. But Jay, as a woman, to be told you'll be losing your breast, you know what that means to her.
Even to men. Let me put it right there. We can't lose it for you.
It wasn't easy. I went back again, running away from the treatment. Until one day I received a call from the surgeon, Dr. Josephine Nsafo. And she goes like, Bridget, when are you coming to start treatment? I said, Doc, I was quiet. If you don't come, we will come for you because we have your address in the folder. And I thought about the whole thing. I said, this should be the wake-up call. So I went. She referred me to see a clinical psychologist. Then she actually spoke a lot about the disease, that I shouldn't even fear. People have gone through it. I didn't have the opportunity to meet a survivor then. But after I met the clinical psychologist, that was a turning point. I agreed to start the treatment, but not removal of the breast first. So we did the chemotherapy. I went through 8 cycles. I was on 2 different medication for the first 4, and the second 4 another medication. And amazingly, after the chemo, the lump disappeared. A lump which was more than 2 centimeters, it had disappeared. You can't even palpate. But during the time of the chemo, so I was taking the chemo every 3 weeks. After each session, it came with 8 wahala. I lost my hair. I had to shave it myself after the 3rd day when I saw it was falling off. I remember this incident when my son, 2 of them, saw the sakura and they were like, Mommy, why did you decide to do sakura? I said, but you have sakura, so I want all of us to have sakura. They didn't know what was happening. So the chemo period for me wasn't easy. I was having chills. My whole mouth was sore, but you had to eat. You were eating and you were not feeling the taste. Even you were drinking water, you don't know it's water. The hair falling off, I've spoken about. Weeks, thank God, to week ups. So you walked out and nobody knew
what you were dealing with.
Yes. Even under the scorching sun, you were feeling chills. In fact, it broke you down. That was it. So after the chemo, and it was every 3 weeks. So after the first week, it wasn't good at all, but you recover for the next one. So 8 cycles. Then after that, during that time, I got a book. That was a breast cancer book from John Hopkins. And so I became my doctor before the others. That was when I got to understand the disease, the types, the treatments, and accepted that I was on the right path. So after the chemo, I had the mastectomy. I lost the left breast. Then radiotherapy. The surgery took about, it didn't take time to heal. Then radiotherapy, 15 days continuous. Yes, and during the radio, the chest wall, the scar, reopened because of the radio. That was the effect.
Radiation.
The radiation. Yes, it wasn't also pleasant at all. Sleeping at night became a problem. Imagine sleeping with your your head on your palm, because if you lied on it, sorry, but that was it for about another 3 weeks. Then after, fortunately, my type, I wasn't going to be on medication. Some people are on medication for as much as 5 years and even beyond. Yes, but fortunately for me, I wasn't on any medication. Just had to get myself back. Yes, to recover fully, get on diets, exercise, and having the opportunity to be here to be talking. It took some time. Yes, because you were afraid of stigmatization, what people may think about you. So I've been quiet, but I think it's about time to speak out and inform the whole world. Early detection.
The mental fortitude it takes after going through such a process, because in telling your story, I can tell that you remember it so vividly, right? You mentioned that you had to work to get yourself back, right? But mentally, how did it play on you? And then also the support of family and friends. I understand that during this time it has to be very, very staunch support. So how did that also help you?
Fortunately for me, I had a good support system, family, that I must say. My husband, being a pharmacist, understood what it was, and family around, my sisters, cousins, my mom, who got to know later, because she's old, so we didn't want to tell her. I had the surgery 3 days before she got to know. Yes, and then my immediate brother too is a pharmacist. I remember even when I needed blood, though I got people to donate, he had to also get me more. Family support is very important. Cousins, I remember being sent to the theater that morning. I was surrounded by 3 ladies who are family, 2 cousins and my younger sister. So they held my hands to pray. They contributed to the bill. One of them, when she even heard the news, before I even started during the treatment, she broke down. I remember when she came to me in the house, she just called, "Where are you?" Share the location. Then she came. She sat on the bed and started crying. "Why are you doing this to yourself? You are so wicked, Yaya. Why? If you tell us, what do you think? Get me your passport." Then it had expired. Said, "Let me renew it for you. If it will mean you going out of the country for treatment, I'm ready." That was it. So I had to calm her down. And then I pulled my folder and how far I have gone with treatment. Said, "Relax, I've started. I'm doing the chemo." Said, "Yeah." When she saw the sakura, I said, "I'm shaving my head so that you know you are not alone." Thanks to Mama Jidwasi, the first. She did that. Said, "I'll shave my hair and then we'll go in." I remember my next chemo session, she was with me in the hospital. She gave me a treat. We had lunch after that. I had lunch with her. It was a nice moment. I'm lucky.
Yeah, you are.
Psychologically, it's not easy, especially when you stand before a mirror and you see like you are half. And you are still admiring the beautiful one remaining. And I go back to the times when I agreed for them to take it over. Should I have said no? But what made me go take that decision was that, it's like a balloon that has been deflated. Even though the lump has disappeared, the membrane is there.
It's dangerous.
It could come back. So if there is no breast, there is no breast cancer. In any case, we came bare-chested.
That is the thank you. Yes,
the breast grew along puberty. And so, what do I gain if I lose it to have life?
That was
the decision. Yes, it's not easy. It's not easy.
So Bridget, a follow-up question. I wanted to find out. There's a feeling if you have two breasts, right? So when one was taken up in the first week, how was the feeling? Because you don't have one. So how was how were you able to emotionally process it?
Even before the procedure, I had psyched myself that, well, it is to give you life.
Yeah.
So when they came to the hospital, they saw me smile. They said, hey, you are strong. I said, I have to be strong.
Life.
Yeah.
For myself, for my family. I have younger children. If I'm gone, who'll be there for them? Yeah. So I didn't really feel it. But after, because the scar is still there, yes, I dress up, you can't even tell. Yeah. If I don't tell you, people still doubt. And I told them, I can remove my chest if you want me to. Yes, for you to see it is true. Yeah.
Doubting Thomases.
Yes.
Sorry. Yes. Let me just hold you for a second, Lenny, and let's get to the medical bit of this conversation. In using Madame Bridget's story, for example, she says she noticed a lump. Now, can you tell us how this comes about? Is there a set that are there different stages before this lump, pops up or starts showing itself in the breast?
All right.
Lenny, I'm sorry. I just to get there.
I've heard so many stories concerning this, so I get where she's coming from. Now, you asked the question. I'll help you answer that quickly. Then I'll move on. You mentioned that if one breast is taken off, how do you feel? There's something we call the phantom pain, a phantom limb. The same thing happens with people that have their arms amputated or their limbs. There's this sensation that is still there. Okay. You have this feeling that you can move your toes and all that. Okay. They call it a phantom pain. So it's never that I'm feeling pain in my toes, but you realize that there's none there. Right. It's the nervous system working its way. Yeah. Okay. Now moving on. Now before we go on, let's always understand is that it always never comes with pain. When it comes to breast cancer, it can start with something as simple as a skin lesion. Yeah. The surface of the breast changing and looking like an orange peel. So we call it there's a French word for it, but it means orange skin. So if you see an orange before, you see where the skin is, it looks rough and bumpy a bit. So the natural breast layer, the surface of the skin changes to that. Secondly, you can have somebody having a discharge, no pain. Then you can have somebody having a lump, no pain. Yeah. So it's these ones that go undetected because it's there. Most people don't really, when they take shower, they don't take time to actually examine themselves. So it will start with something so small as maybe a peanut. Yeah. Then it graduates. Now the breast, when we are describing this, is divided into segments, like a pizza. Imagine the breast divided into like a pizza size slices, all leading to the nipple area, right? So you have like maybe I 1, 2, 3, 4. So it could start in I, and that could be probably your stage 1. It hasn't spread to other places. Now your stage 2 could graduate to other segments. Stage 3 could lead to your lymph nodes down there, your breast and your shoulders. The lymph nodes are what we call for lack of a better word, it's like a zoom line of your body. Every waste material, that's where it goes. We dump it there. We dump everything that is like toxic, everything in your lymph nodes. That's why when you have an infection, we feel your lymph node is swollen. So it graduates from your lymph nodes. So now it's attaching itself to your underlying skin tissue. Under the breast, there's muscle. Yeah. Men have muscle, but we have our breast being small, so you don't. So women have, though the breast is movable, beneath it is muscle tissue that is there. Now, that same cancer is now spreading to the muscle tissue. Okay. So in the sense of, when you look at surgically, you see how I'm starting with this. First, it could be something so small that I need to just take a resection. Maybe take the lump out and small muscles around the lump. That's okay. That's the first one. Second one is maybe I might have to go and remove a lot of the lumps. And then probably say, okay, it's too many lumps, so let me take out the whole breast. Then it can affect the fact that the muscle is affected, so I have to take off the whole chest wall. Okay. Then your lymph nodes is affected. Then the last stage, which is very, very dangerous, we call it end organ stage damage because it's moving on. It's spreading to other organs. Now it's in your kidneys, in your liver, it's in your intestine. The cancer is going everywhere. So that's the stage where we start doing palliative care in the sense that we make you comfortable. We start to make you comfortable. We bring family around you in preparation of your death.
For your death.
It's a very difficult conversation to have as a physician. To tell a patient, because we are supposed to give hope. So what we do is that we try to bring hope by adding a bit of spirituality, religion, gratitude, faith.
On the right there, and let me just ask Bridget that question of that moment. And I think it's in a similar question that the CEO asked about in communicating this to you right from home. did you have an idea what you were going to be told? When you got there and they broke the news to you, yes, how did you feel? At what stage were you in this, as described by Doc?
Okay, I always say, fortunately, mine was detected at stage 2.
Okay.
And if I had gone earlier, a simple lumpectomy.
Yes. Oh yeah. You see, they start knowing the terminology.
You're supposed to say stage 2. At what stage is this?
Stage 2 is when the lump is attaching itself to some of the breast tissue and your ducts.
Okay.
Right? So it's not just a small peanut anymore. It's actually growing a big in size. So in that case, that's why I think they're referring to mastectomy. They're looking at mastectomy because they felt if it's that big, maybe it's going to other place. So we have to take out the whole breast.
It was actually spreading to the nipple area.
Okay.
Yeah, per the mammogram. Yes. So at stage 2, and that was where I felt so sorry for myself that I did not go early. And especially when I was the one blowing the gong.
Yes,
the trumpeter itself.
Yes, it's going.
The noisemaker itself.
It's going through.
So
but Doc, you when Bridget was telling her story, she mentioned that after doing the chemo and all of that, there was still a need to do the mastectomy, right? How does this play out? Because you also think that when you do your chemotherapy, you'll be okay. You may not need to do the mastectomy, right? In which cases does this have to happen? Because also, I think that the psychology of the individual going through that, even some people don't want to do chemotherapy because of all of the side effects that it has, right? Now, to have to go through all of that and then now know that at the end of the day, you could have just gone straight to a mastectomy and maybe not done chemo at all.
Yeah, so I'll use it for those listeners. I want to create this view. When we are eating, let's say food, you put food up, you are ready to eat, right? And a housefly lands on that rice. You see what you do? Most people don't want to throw the whole food away. So there's 2 options there. Either you try to cut away that area. You don't just take where he landed. You try to get a bit extra yard way. That's the first one she's talking about.
Okay.
That's the first thing we want to do. The second thing is that we look at it and be like, what if it actually went down further? So heat comes in.
Okay.
You want to apply heat to try and disinfect the food, put it in the microwave, whatever it is. So radiation, microwave. You are microwaving the food, trying to kill everything that is possible, any chance. But the problem with microwaving food, if you yourself know, is that it changes the structure of the food.
It does.
Yeah.
If I cook rice right now and I put in the microwave, though I just cooked it, it will make it probably dry.
Yeah.
So it dries harder, right? Now the next part is either chemo, which is we put drugs in your system, try to fight it. Now chemo, in our sense of our food, is probably you thinking that okay, I tried the heat, probably didn't work. I should probably think about maybe chopping some onions and adding more vegetables to make the food smell a bit better. Because sometimes you think the smell can put you off, so you want to probably add some chemicals and some soy sauce there to try to. That's where it is. The reason all these things are capable is because we are doing all these things because you are trying to we try to reduce cost. Reduce damage to the person, psychological, mentally, physically, the body itself. So you are looking out for the least.
Yeah.
You look at the least before you go to a marathon. So when we are even discussing it, we don't talk about surgery first.
Yeah.
We are trying to look at medication. Can we give medication? Let the medication help this. And then we see the medication doesn't go. Then we say, okay, can we try this? Can we try that? Because surgery is last option.
Yeah.
Yeah, okay.
Because taking out somebody's breast is not a decision that is taken lightly. I always used to ask people, somebody asked me the question that, why, in anatomy, right? A professor was asking, why the breast, what's the importance? Apart from the fact it's breastfeeding, what is important? And the answer was aesthetics.
Yeah.
Confidence. A woman's breast, her face, her hair, is her confidence.
Which is a question I wanted to put there. Do you feel confident? Did you feel confident? Do you feel confident?
Right now, yes, because of prosthesis, I would say yeah. But naked before the mirror,
you still feel the pain of what you are not, or what you used to be. Yes.
I'm just accepting that, well, it has happened. So because I'm going to live with it.
That is it.
But as I speak, if in future I may decide to take the second one off.
Yes.
So that I'm getting that
safe.
flat chest back.
Yeah.
You see, there are also options where plastics can come in. cosmetic surgeries can come in. We can give you a new breast.
Yes.
So nobody will know.
Yeah.
You stand in the mirror, you can go to your beach parties or wherever you're going to, and nobody can tell.
But if you get a new
The issue
breast,
too is that you can't breastfeed.
Exactly.
So it's an option only given if sometimes we look at, have you given birth already? Have you breastfed already? Because we had cases where the person was young. We took it out, gave the person artificial breast. It looks beautiful on the outside, but the partner had to be cancelled and told that this is how it's going to be. She can't breastfeed.
Yeah.
That reminds me,
Sorry.
during my treatment, I had the option. I even went as far as seeing the plastic surgeon, and they were going to just empty the breast, that's taking out all the tissue and fill it up with an implant. But it comes with cost.
That one also has its own issue.
Yes, it comes with cost. So, and then I wasn't in the position to afford, and so I just decided to.
So look, I have a question. So aside, aside the fact that breast cancer sometimes are genetic, what are some of the causes? I think is really important.
So we don't like using words like cause, because honestly, medicine doesn't understand.
Exactly.
We don't understand breast cancer. We don't understand cancer itself.
Yes, cancer itself. Yeah.
We don't understand why, because if I explain the basic identity of like a cancer is that a cell that is growing somewhere else, or is growing at a rate that is not supposed to be growing. For example, if I find your skin tissue, like skin cells, they are different from what is in your intestine. If I put your skin cells in your intestine, it becomes a malignancy. Because it's not supposed to be there. So to start multiplying and we'll have it there. So you're like, you test them like, I'm seeing skin in your intestine. Why? That's the problem. Now, secondly, we call them risk factors. What things predispose you to get your chance or increase your chance of getting? The first one you mentioned is genetic predisposition. So there are certain genomes in your DNA that can predispose you to cancer. If it's in the family, there's a chance that you get. But that does not mean an absolute that the fact that someone in your family, because you mentioned there are probably sisters in your family who don't have it, right? So that's there. The second one is hormonal treatment. These are contraceptive pills, right? Now, the risks of cancer, breast cancer, deals estrogen, which women have, hormones. If your estrogen is high, cancer proliferation is higher, right? So in dealing with somebody who's menopausal, we give them hormone treatment. Some of these treatments can predispose them to cancer. Secondly, somebody who is taking contraceptive pills, they are hormone treatments too. They increase your estrogen level. The good thing about contraceptive pills is that if you stop early, your body can get rid of it out of your system and stabilize. But the continual use of contraceptives can predispose you to breast cancer. Thirdly, smoking, alcohol abuse. These two, that's social vices. As a woman, actually, if you have not given birth yet, we argue the fact that already there's a clock on you. There's so much hormones and everything going around. So we advise that certain things like smoking, alcohol, you take it in moderation or at all, cancel them out, right? That doesn't mean that the men are excused. We are also of the same. Just that 1 out of 833 men will get cancer. If you put 833 men, one of them will get cancer, breast cancer. So if you look at these numbers, the next one I also talk about is the fact that we are not healthy enough. Some of these GMOs, these genetically modified foods that we eat, I don't want to mention brand names and all that, the sodiums, the salts and other things that are added to our foods, it's changing because those who are older than us will tell you that those times when you mention things like hypertension, cancer, it was somebody who was older.
Way older.
So when we were studying medical school, they give you age groups, cancer age groups. The risk factor was if you are in that age, there's chance that right now I can't use that age bracket anymore because you have an 18 getting a breast cancer, or somebody 23 getting a breast cancer. So the parameters are changing. The playing field is changing.
Talking about that, please, are there any meals you are staying away from? Are you on any diet aside medication? But are you on what's your lifestyle now?
Okay, I do mostly plant-based.
Okay.
So I'm cutting down on meat. That doesn't mean I don't take. I cut it down drastically. Yes, plant-based, less sugar.
Okay.
Less sugar, less alcohol. Yes. Less alcohol. Occasionally.
One has to knock the.
So look, I have another question. So the how do you call it? The examination.
Yes.
What I've noticed is that when you are at the time of the month and you examine, you get confused. You see a lot of lumps everywhere.
Yes.
So at what point is the right time for the test, like your self-examination, number one. Number two, how are you able to tell which lump is normal and which one is that lump that you need to start running?
Your partners.
All right, so in doing this, a very good question you raised. For example, she mentioned something that when she was breastfeeding, they were not wrong. When you're breastfeeding, we don't like to do a mammogram for you because the breast is already dense because you are producing milk. So a lot of structures will be hidden. If you do the mammogram, you can get the details you're looking for. So we usually recommend 2 months after you wean the child, you can come in and let us do it. Now, that's in hindsight. Maybe as years go on, more technology will come up where we can bypass some of these things. Secondly, in examining your own breast, right, the lumps, in when you're ovulating, some of these are formed. Your breast gets heavier, nipples like get sensitive and all that. I always say the breast they are twins. Whatever is in the left should be on the right. So whatever you feel on the left at a certain position should be the same one you feel on the right at a certain position. As long as there's variation, it's something of concern. You should get a mammogram done. Some are offering mammogram at 300 cc, some are reduced 250 and all that. We are trying to encourage more people or some of these agencies to reduce the cost so that more people get it done. We are trying to even create, maybe 3 Minutes can champion that, where 3 Minutes creates a common fund where we all contribute towards people to support breast cancer. Right? Because you can see that breast clinics in some of these places. Yes, because apart from we telling somebody about, the next step is get a test done, which requires money. Question is, where do you go? Right? For example, the breast examination I'm talking about, when you're examining, you are looking out for, you need to know what you are looking out for. Just don't look out for lumps. If our producer projects what I want you to look out for, you're looking for discharge, the nipple. So you squeeze your hand against the nipple. If you can see, you put your hand against the nipple like this. Try to squeeze against it. If there's a discharge, that's a sign for you.
I mean, can we have that that image on the screen? I think
I have a question.
Yeah, go ahead with your question.
But it's for both Bridget and Chris, right? You mentioned that
prior to that,
maybe in the future,
Lenny, I'm being told we need which particular chart are you referencing so we can put that one up. There were different ones. I think I saw one. Is it the one that has different
types of breast? Yes, that one.
Yes.
Yeah,
okay.
That one.
Cool. I'm sorry. I'm just following instructions.
he's so excited about this thing. You can tell, eh?
Oh, let me ask you your questions like this excitement.
Anyway, my question is, you mentioned that maybe sometime in the future you'd need to take off your right breast as well. What's the need for you? And then, Doc, in which cases should that be the option as well? If there's another lump or not, if you just want to take it off so that you are at rest.
Okay, so during my biopsy, there was another smaller lump in the right.
Okay.
But when the specimen was taken, it turned out to be condensed more because I had just finished breastfeeding. So that was the breast milk calcification.
Okay.
Yes. So
the way you mention our terms, I'm just so proud of you. Like it means you were paying attention during ward round.
Yes.
But we come to their beds in the morning. When you're on the ward, we come to their beds in the morning. We are students. Our professors are teaching. We are asking questions. So some of these patients actually listen to whatever we are saying. They read on what we are. So you can't just come and say whatever you like.
Yes. So it's not growing.
Okay.
As fast as the other one. So I wouldn't wait for it to get there. Yes, that is what I'm saying.
Okay.
I may decide to just get rid of it also.
Okay.
Yeah.
Let's have the image on the screen and Doc can speak to it. I think that's. No, it's important that we know. You understand? Okay.
All right. So when we are describing breast, I want everybody to, if you are looking at the image right now, you can tell every breast is different.
Yeah.
Right. So that's why this body shaming thing about people's breast, I'm really against that, because what you have, as long as it works, I don't have a problem with that.
Teardrop.
So you have the relaxed, you have the round, you have the side set. By looking at it, you can tell which one yours is.
Of course.
You just keep it in your head. You don't need to let anybody know. A slender, asymmetric, you have the athletic type. You have all these types, right? So how you're examining, for example, if you are the relaxed type, you realize that it's a bit lower, the muscles are a bit loose. So when you're examining, you might have to lift the breast up and then examine it. But you have to get closer to the muscle underneath to push it against. Now, the reason why we push it against is that when you push against something hard, if there's a lump, you feel it. Okay. And then you round in a circular manner, rub it against the chest wall in sections, right? Then you press it against the nipple and all that. Pain is very important too.
Yeah.
Right. Sometimes the pain can be due to maybe a medication you're taking, maybe your sleeping posture. There's also that. It's better to rule these things out than to assume that it's fine. Now, when we have signs and symptoms of breast cancer, we realize that we have the nipple discharge as one. Change in the size and shape. I remember I told you that they are twins. So any change in one is a cause for concern. then a lump in the breast, which I think everybody in the world thinks that
naturally we don't have the same women. Humans.
Close enough. It's very, very close. Okay. It's very close. You can't tell.
Change.
Yes, this is a significant change.
Yeah.
It's like your left and right foot. We always say one is bigger than the other, but it's not really. You can't really tell.
Yeah.
So then the next one we go to redness, which is very important.
What color is the discharge? Is it a normal breast milk color or mucus?
It can be blood. It can be brown.
Blood.
It can be milky. It can be yellowish, creamy. It's better for you to take a sample and let somebody tell you that, this is just milk. Like what she did. They took a sample, realized that it's not.
No,
I look out for smell as well.
Smell is also part. Remember last time we talked about vaginal discharge, we talked about the smell, the color. All these are important. The next one I want to put to understand is the skin surface.
Yeah.
The surface of your breast, it should be smooth.
Okay.
It shouldn't be rough, rashes, all these. So I remember this weekend somebody showed me their breast, realized that there was some pigmentation on it, and the person was very worried. But when we went through the history, we realized that I asked her a few questions. And said she has changed. She bought a new bra, and then the new bra she didn't wash it, and so we assumed that maybe the chemical that used to preserve the bra was what caused everything. So we put her on medication to see the allergies, but we'll do the mammogram still, just to rule out both sides. You get where I'm going with it? So when you come to us, we don't just say, okay, it's a breast cancer, and let's go straight for it. No, we look at it could be something minimal. Like I ask the questions like, have you changed your diet? Have you eaten something? When you were your partner, did he maybe sometimes orally he could have chewed a gum that you are probably sensitive to, right? That's what brings up a question about the myth about the bra causing breast cancer. It's a lie.
Okay, it's not.
The one
with the metal.
Bra, no, please. There's no research to back that.
Okay.
And I'm sure if there was a research to back that, I don't think any of those who produce bras will
still be
doing that. Right? Yeah, and that's what you want to hear. Is whether a man hand fondling or hand your breast is no. So if Debbie, go to my mates for me. Honestly, there's no research to back that.
Okay.
But there's an understanding to it in the sense that if your partner, it keeps handling your breast, your permission. I'm using these words carefully.
Yeah, very important.
Permission, consent, and also guidance. It's somebody's breast. She can teach you how to handle. Some people squeeze it. Guide her because some people squeeze it like it's a melon.
Okay.
Right, and you can cause redness. You see, if the person is light skin, the way you massage it can make a person, it's so red. Comes to the hospital running, and I have breast cancer, it's red. No, and then you can see finger, you can see hands. No.
Can we have the myths on the screen as well?
Yes. So
The myth number one says sucking on breast prevents breast cancer. True
it's false. So our thing is, what I'm saying is that when your partner is doing it, he might feel something that he didn't feel the day before, and tell you that this was not there before, or the skin is not like this before. Yes. That's the understanding we have, that somebody is helping you do the exam, not that the person is some scientific product that
even an attentive.
Yes, and also it's good. When you have a good partner and you are going through that sensation, it brings all those hormones that are passing through. They help heal the body. Girl gives release stress and all that. Yeah. So all these are reducing your risk of cancer and other conditions.
But Doc, I agree with what you just said, because I know of one family member and two friends who is their partners who noticed the lump. Yes, and at Smith Hospital they took it off. It's a partner who actually said, I'm feeling something here. And truth to be told, when they went to the hospital, they had to. One was getting there. They said stage 1 or something. They started. One, it was just a lump, but they thought, no, let's bring it out. In future, it can be
something else. Yeah.
So it's safer. So we need the men to pay attention. They shouldn't be, like you're saying, they should pay attention and be attentive.
Amen.
They didn't feel anything.
Yeah, and why we are saying that too, we should also understand that the women too should stop changing partners.
Amen.
Because the more you keep switching, how anybody notice?
But what you are saying means that the women are changing partners every day or every 2 days or
so it's just when you keep to one, he will know
the former partner wasn't yes. So the next one
and on that conversation, please, I'll be wrapping it up almost with you, but I want to ask about how you touched on lightly, but what has been the effect on your partner?
Yeah. Well, he's a matured man.
Okay.
Who is in the medical field as well. So he understands it even before me.
Yeah.
And keeps encouraging, this is nothing. Yeah. When I am down, this is nothing. So I think he's stronger than me.
Wow.
Being supportive.
So it's the support system.
Yes.
The support
really
system.
important.
Because the reason why most people don't come is number one, fear. The way the society see them. Because you have people who don't go home after the surgery. Because their partner is not accepting.
Charlie.
Yes.
It feels like I married a woman. I married a woman. You know, it's sort of thinking.
I know.
Are you a man now? Are you a woman? Because
Imagine.
But what happens to for better, for worse, in sickness and in health?
that one.
Men there.
That one.
Well, I see the people now changing it a bit. We'll come to that. That topic will
I
soon
have
for
a
another day.
last question.
Yeah,
Okay,
let's-
so I had an experience of someone getting. They said, "Is it rupture or something?" The breast actually blasted. I don't know the word. to use.
Yeah, so
How can that be?
yeah, so there's even a research on it that we had a case from the north. That's my professor. They had a case in the north where they were referred to by somebody in Ghana. They didn't know about it. Somebody in Germany actually referred the case to them. That this is an image of somebody I've seen. And can we help the person? And she had an issue with her hormones. The hormones that develop your breast, they develop your hips, everything. So she had an issue where the hormones were coming faster than they should. So the breast got bigger and bigger and bigger. That's an issue. So her breast got bigger, and because the society in which she wanted, she didn't know what they would do. So they started cutting and putting herbs, you know. They tried to fix it. By the time it got to Accra, the damage to the nipple had it. So they had to do a breast reconstruction and take out all that tissue. So it can happen. You sit there, as she said, early. Early detection can change you from stage 1 to stage 4 or 5.
Wow.
You get what I'm saying? You are going to go from paying something as little as a small amount of money to have a small lump done to having your whole life turn around.
Yeah.
Does it affect breastfeeding? Does the baby get affected?
Yeah, the baby gets affected, milk production. All these cancers are being formed in the ducts, the production line. So you are talking about, let's use VRE for example, where your power is being produced, where milk is produced. The pipelines that carry the fluid to the point at which you open your tap, where is the nipple? The nipple becomes your tap. The cancer can be at the nipple, can be in the pipeline, can be at the production point.
Yeah.
So then the child is supposed to breastfeed. There'll be nothing coming out.
Yeah.
Wow.
But I mean, does the cancer, can it transfer to
No, it can't. That's the thing. Cancer is not infectious.
It's not.
That's the difficulty about cancer. Cancer is not infectious that you can get a cold, I'll get a cold.
Yeah.
So that's why it's genetic. It's DNA inbuilt. The structures that destroy cells, the structures that give us new cells, the structures that help us grow, the hormones, the system. That's where it's being attacked. That's where the problem is.
Yeah.
So it's structurally. So your fruits are supposed to come out orange, like your tomato is supposed to come out red. It comes out yellowish.
Okay.
Because there's a structure in place that's supposed to turn it from yellow as it's ripening to orange. But there's a structure that changes to, that's why you have decomposition from red and it starts going to black or dark brown.
Well, I wish we had the whole day to have this conversation. But before we wrap up, and Rashid be giving us our closing remarks. So before we wrap up, if you want a British degree at a fraction of the cost, also a vibrant student experience in a community that will equip you with useful employability skills, taking you a step closer to your career of your dreams, then you can enjoy all this plus up to 50% on your scholarship from Lancaster University, on your degree from Lancaster University, Ghana. If you want more information, go to their website. It's lancaster.edu.gh or call 0209 60 70 08. Or hey, place an email to them as well on admissions at Lancaster University, at lancaster.edu.gh. Lancaster University, Ghana is the only British university campus in West Africa. Madam Bridget, thank you so very much for joining us here this morning. Madam Rash, I leave the last words to you as well for us to wrap up on our commitments, as a media house to creating this awareness, and also thanking Madam Bridget for her visit to us this morning.
I'll say we should stay abreast and check regularly. Early detection will save a life.
So see something, say something.
See something, say something. and our men, they should be attentive.
Very attentive.
Very, they should be, because I happen to know, as I mentioned, 3 cases that it is actually their partners who saved their lives. So let's be attentive. See something, say something. Early detection and treatment, and we will be alive. Our breast will be saved.
Thank you very much. You see, the men should also check themselves as well, and the women should also check the men as well. So all this, Madam Bridget, thank you so very much for joining us. Chris, thanks for pulling this off as well. Lenny will always be there. Your brothers to support you in. It's from Cyril, it's not from me. He's telling me. But on that note, we'll be back here same time tomorrow, Wednesday on Culture Daily. We out.